Well, we've talked about sexually transmitted infections a couple times in the past week, and today we're going to jump on it again because of a new study that came out from the World Health Organization. But did you know there are 30 different bacteria, viruses, and parasites that are known to be transmitted through sexual contact? Of the 30, 8 of these are linked to the greatest incident of sexually transmitted disease, and 4 of these they are currently curable: syphilis, gonorrhea, chlamydia, and trichomoniasis. And 4 are viral infections and are incurable: hepatitis B, herpes simplex virus, HIV, and HPV. So that really leads me into the study. It's published in the bulletin of the World Health Organization, and it goes over the global prevalence and incidence estimates from 2016 of these 4 curable STIs. So in a nutshell, what do we see? They say every day there are more than 1 million new cases of curable sexually transmitted infections among people aged 15 to 49, according to this new data. This amounts to more than 376 million new cases annually of the 4 infections: chlamydia, gonorrhea, trichomoniasis, and syphilis. Peter Salama, he's with the World Health Organization, he said, "We're seeing a concerning lack of progress in stopping the spread of sexually transmitted infections worldwide. This is a wake-up call for a concerted effort to ensure everyone, everywhere, can access the services they need to prevent and treat these debilitating diseases." And the bulletin that I showed you just a second ago breaks it down about how many cases annually per disease. And there's 127 million new cases of chlamydia in 2016, 87 million gonorrhea, 6.3 million syphilis, and the most common curable STI is trichomoniasis, the parasite, 156 million cases annually. And it goes on to say that these STIs have a profound impact on the health of adults and children worldwide. If untreated, they can lead to serious and chronic health effects that include neurological and cardiovascular disease, infertility, ectopic pregnancy, stillbirths, and increased risk of HIV. And a topic that I've harped on for a long time is congenital syphilis. And here they say syphilis alone caused an estimated 200,000 stillbirths and newborn deaths in 2016, making it one of the leading causes of baby loss globally. Horrible, horrible stuff. Then they say on average, approximately 1 in 25 people globally have at least one of these STIs, with some experiencing multiple infections at the same time. So yeah, it's not uncommon to see co-infections of these different STIs. STIs spread predominantly through unprotected sexual contact, including vaginal, anal, and oral sex. And some, like chlamydia, gonorrhea, and syphilis, can also be transmitted during pregnancy and childbirth. And in the case of syphilis, through contact with infected blood or blood products and injecting drug use. Now, the good news is that STIs are preventable through safe sexual practices, including correct and consistent condom use and sexual health education. Timely and affordable testing and treatment are crucial for reducing the burden of STIs globally. So let me go over the treatments for these 4 STIs real quickly. And for chlamydia, easily cured with antibiotics. Persons with chlamydia should abstain from sexual activity for 7 days after a single dose antibiotics or until completion of a 7-day course of antibiotics to prevent spreading the infection to partners. It is important to take all the medication prescribed to cure chlamydia. And it goes on to say, repeat infection with chlamydia is common. women whose sex partners have not been appropriately treated are at high risk for reinfection. And some of the horrible side effects can be, having multiple chlamydia infections increase a woman's risk of serious reproductive health complications, including PID and ectopic pregnancy. For gonorrhea, a little bit trickier. It can be cured with the right treatment, the CDC says. And currently, they're recommending dual therapy using a single dose of intramuscular ceftriaxone and 1 gram of oral azithromycin. And so the issue with gonorrhea, as opposed to these others, is there is quite a bit of antimicrobial resistance in gonorrhea, and it's becoming a big concern. So that's one of the issues. But right now, that is the regimen for treating gonorrhea. For syphilis, quite a bit simpler. Syphilis is quite easy to cure in the early stages. A single intramuscular injection of long-acting benzathine penicillin G will cure a person who has primary, secondary, or early latent syphilis. Now, 3 doses of long-acting penicillin G at weekly intervals is recommended for individuals with latent syphilis or latent syphilis of unknown duration. The treatment will kill the syphilis bacterium and prevent further damage, but it will not repair damage that has already been done. And lastly, trichomoniasis. This is not a bacteria like for chlamydia, gonorrhea, and syphilis. This is actually a parasite, but it is treated with an antibiotic. Trichomoniasis can be cured with a single dose of prescription antibiotic medication. Metronidazole is probably the most common one. It's an oral drug taken by mouth. It is okay for pregnant women to take this medication. People who have been treated for trichomoniasis can get it again. In fact, about 1 in 5 people get infected again after 3 months after treatment. So this is really important to make sure that your partners are properly treated too, because there's really that ping pong effect with trichomoniasis. So anyway, yeah. This has been a big topic this week on this program, and again, we just see these massive numbers, more than 1 million cases of these 4 STIs on a daily basis globally. So anyway, I hope you enjoyed it. Like it, give us a comment, hit the subscribe button, and I'll see you next time on the next infectious disease news brief.
And don't forget to check us out at the website, outbreaknewstoday.com, the podcast, Outbreak News Interviews, which can be found on the website, on Apple Podcasts, Stitcher Radio, and Spotify, and the Outbreak News This Week radio show, which is aired Sundays at 1 p.m. Eastern Time in the Tampa Bay area on AM 1380 The Biz, or online streaming at 1380thebiz.com. And check out our social media presence, Facebook at Infectious Disease News, and Twitter at BackDman63. Outbreak News TV is a production of The Global Dispatch. Copyright The Global Dispatch Incorporated, 2019.